Welcome back. COVID cases dropping across the country. That's the good news. But according to the CDC, still 2,300 deaths a day from this illness. The mask mandates are also dropping tonight from New Jersey to California. Restrictions are loosening as cases go down. Even New York, one of the areas hit hardest by Omicron, is letting its indoor mask mandate expire this week. And that goes for schools as well. Though the White House and the CDC are still saying it is too soon. Dr. Monica Gandhi is professor of medicine and associate division chief at UCSF, and always a pleasure to talk to her here on the program. Dr. Gandhi, thanks for being with us. I was listening to some sound bites from CDC Director Rochelle Walensky earlier today. She said now is not the moment to drop mask mandates in school or other public places. Where do you land on that?
You know, I think it's been really confusing messaging all around. About the last 4 days in every single major paper, CNN, New York Times, Washington Post, everyone has a different opinion on mask mandates. And a lot of people have been calling for mask optional now because the cases and hospitalizations are going down. And like you just said, New Jersey, New York, Delaware, Connecticut, and Oregon all gave a date for when they're dropping mask mandates, California as well, but not for schools. I think we need centralized sort of guidance, but I would say as a general principle that we should go on hospitalization metrics. Metrics makes the whole country uniform, so we're not doing all these different things. And the reason I would always go on a hospitalization metric is that's why we did what are called non-pharmaceutical interventions to begin with, to keep our hospital capacity able to manage patients. So I would probably go with something like, as long as you have 80% ICU, 20% ICU capacity, so you have less than 80% people in the ICU, then that's a good metric for dropping masks.
And where are we now?
So it's very interesting that we seem to also be a little bit all over the place with data. And the reason that we're all over the place with data on hospitalizations is something that President Biden said yesterday. We have not been classifying hospitalizations very precisely. There are people in the hospital with COVID, and there are people who have their swabs are positive and they came in for something else. It's called with COVID versus for COVID. And President Biden announced yesterday that we need to do some more precise numbers and calculations, because it actually can make vaccines not look like they're working in highly vaccinated regions like my own, where they're working very well in San Francisco.
So in terms of the masks, are you saying the prudent way to proceed is wear the masks still until we have better information on the data?
Actually, there are many places where the hospitalizations and the ICU rates have gone to where I just said. So again, if you have 20% ICU capacity, I think that's a really good metric. And New York, New Jersey, Connecticut, Oregon, California, everyone who dropped the mask mandates are there. And then we have to look at other places and try to make it uniform.
Adding to the confusion. Sorry, my head is spinning. You study the numbers, though. Speaking of the numbers, I want to ask you about this. So 25% of children report having symptoms of depression right now. 20% have symptoms of anxiety. Obesity skyrocketed in 2020. So our kids, socially, emotionally, are impacted by this pandemic 2 years in. The data shows they're struggling. The decisions we make now will follow our kids for years to come. What do we need to be doing right now to intersect this as parents, as teachers, as medical professionals? I'm just so afraid of what lies ahead for them.
Yes, I mean, I think three things. I think remote learning worked for some children and not for a lot of children. I think that not having children be together when it's such an important time of socialization was a problem with our pandemic response because, as you know, this country closed schools more than any other place. Europe really worked hard on keeping their schools open. So we can address this now. I think we need to come up with that metric and stop the mask mandates in schools, because seeing each other's smiles and faces, that helps with socialization. That's totally normal. They're fully vaccinated high school classrooms that have been masking longer than adults have been masking. And then the second thing is obviously mental health services and building back. When we say building anything, it's about public education and putting more mental health services into schools.
Well, removing the mask certainly would help so they can see each other's smiling faces, get to know each other, and socially, move forward. Do you think the CDC is going to do that based on what they're saying right now?
I really think they do need to, with all of these clamoring experts saying it's time to tell us when masks come off school in children in schools. Again, I would use a hospitalization metric, and most places in the country are there with the ICU rate. And I think they should do that, because even the head of the AFT this morning, the American Federation of Teachers, on MSNBC, Randy Weingarten, said, just give us a metric and we'll do it. So I think they just need to come up with a metric.
All right. We're out of time. I wanted to talk to you about long COVID, so it gives me an excuse to have you back. Dr. Gandhi, as always, thanks for talking to us. Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.